Assalamualaikum and hello everyone. Today my friend and I would like to present to all of you about infertility in Malaysia. First thing first, I would like to introduce what is infertility. So, infertility is actually a condition where one is unable to conceive within 1 year or longer of regular unprotected intercourse without the use of birth control. Apart from that, it also can be defined as inability to carry a pregnancy to full time. What I mean here is a woman can get pregnant, but unfortunately, she keeps on having miscarriage or stillbirth. Infertility can be divided into two, that is, primary infertility and secondary infertility. Primary infertility is where someone who never conceived a child in the past has difficulty in conceiving, whereas secondary infertility, in the other hand, is someone who has had one or more pregnancies in the past but still having difficulty in conceiving again. However, infertility is not always a woman's problem, as both men and women can contribute for infertility. Just want to clarify on this topic by providing all of you with this current percentage causes of infertility through a pie chart in Malaysia. Here we can take a look at that. Approximately, there are about 30% of infertility causes stem from each man and woman, while the rest it is caused by postpartum problems and due to unknown causes. In Malaysia, there are about 10 to 15% of couples experience infertility problems. A couple should try to get pregnant for at least 1 year before seeing a doctor if the woman younger than 35 years old with no apparent health or fertility problems and regular menstrual cycles. Nevertheless, in some cases, some providers will evaluate and treat couples aged 35 years or older after 6 months of trying unsuccessfully. This is because fertility in women is known to decline along with the increases of age. Here, I also provide a bar chart to show the pace of fertility declining over years widely across the men ethnic group in Malaysia. Chinese population with total fertility rate of 7.4 has declined to about 1.1 in 2018. Meanwhile, the Malay and Indian population in Malaysia also facing similar drop in their total fertility rate from 6.1 to 2.4 and 8.0 to 1.25 in 2018. There are various factors leading to infertility that occur for both men and women. After all, we should understand and establish the causes how infertility occurs. By understanding all the steps for becoming pregnant, the egg development and ovulation, we can detect where there can be a problem with any or several of these steps easily. Thus, individuals and couples who are unable to conceive a child should consider in making an appointment with a reproductive endocrinologist who is a doctor responsible and specialized in managing fertility. By that, doctors will begin to treat infertility by collecting medical and sexual history from both partners, includes a semen analysis, a tubal evaluation, and ovarian reserve testing. And only after that, the doctor will recommend specific treatments for infertility based on the factors, the duration of infertility, the age of female, and the couple's treatment preference. In Malaysia, there are treatments offered for couples having trouble starting a family, such as hormone injection like Novaral and Ovidural, where it is usually used along with other fertility drugs to trigger ovaries to release an egg. Apart from that, there are also intrauterine insemination IUI treatment, where a healthy sperm is placed directly into the uterus using a small catheter to increase the chances of fertilizations. And the last one is in vitro fertilization IVF treatment, where mature eggs are collected from ovaries and fertilized by sperm in a lab. Last but not least, the couple is suggested to perform fertility screening before marriage. This is in order to help them in preparing mentally and physically for pregnancy as soon as possible. Time is gold. As time progresses, fertility problem only worsen. Therefore, they will not procrastinate too long until the problem is incurable.
Now, let's jump to the factors of infertility. As you can see, there are many factors that can contribute to infertility in our society. One of the factors is behavioral and lifestyle, which can affect both male and female fertility. The first bad lifestyle is smoking. It affects not only smokers but also people who are exposed to secondhand smoke. As a result, it can reduce sperm quality and quantity in men and lead to hormonal imbalance and reduce ovarian function in women. Recreational drug use and excessive alcohol consumption also can be the factors of infertility. They can interfere with hormone production, sperm quality, and menstrual cycles, affecting fertility. The next factor is excessive or intense exercise. This is especially in women because it can disrupt menstrual cycles and ovulation. An ideal weight is also important to stay fertile. Women with a BMI outside the healthy range may experience irregular menstrual cycles, hormonal imbalance, and ovulation disorders. On the other side, men who are overweight may have reduced sperm quality, while underweight men may have lower testosterone levels and impaired sperm production. Consuming diets which are high in processed food, sugars, and unhealthy fats can contribute to hormonal imbalance, inflammation, and oxidative stress, all of which can affect fertility. Lack of sleep and overwhelming stress can affect reproductive hormones, including those involved in ovulation and sperm production. While not a lifestyle choice, age significantly impacts fertility. Fertility declines with age, particularly in women after 35, due to a decrease in the quantity and quality of eggs. Now, we are going to focus on the factors that contribute to infertility in men. Varicocele is one of the factors that affect male infertility. Varicocele is a condition characterized by the enlargement of veins within the scrotum, similar to varicose veins that occur in the legs. The veins become dilated and twisted, leading to a higher temperature in the testicles. This increase in temperature can affect sperm production and quality, potentially leading to male infertility. Next, we are going to focus on the factors of women infertility. One of the factors is ovulation disorders. Ovulation is the release of an egg from the ovary. Problems with the regulation of reproductive hormones by the hypothalamus or the pituitary gland, or problems in the ovary, can cause ovulation disorders. Some of the disorders are pituitary gland malfunction, hypothalamus malfunction, and polycystic ovarian syndrome. Polycystic ovary syndrome (PCOS) causes a hormone imbalance which affects ovulation. PCOS is associated with insulin resistance and obesity, abnormal hair growth on the face or body, and acne. It's the most common cause of female infertility. The next factor is tubal diseases. It happens when the fallopian tubes prevents the sperm from reaching the egg for fertilization, or prevents a fertilized egg, which is an embryo, from reaching the uterus for pregnancy. Causes of fallopian tube damage or blockage can include pelvic inflammatory disease, which is an infection of the uterus and fallopian tubes due to chlamydia, gonorrhea, or other sexually transmitted infections. It can also be caused by previous surgery in the abdomen or pelvis, including surgery for ectopic pregnancy, in which a fertilized egg implants and develops somewhere other than the uterus, usually in a fallopian tube. Next factor is endometriosis. It occurs when tissue that typically grows in the uterus implants and grows in other places. Outside the uterus, the tissue thickens and bleeds, just as typical endometrial tissue does during menstrual cycles. This extra tissue growth and the surgical removal of it can cause scarring, which can block fallopian tubes and keep an egg and sperm from uniting. Endometriosis can also disrupt implantation of the fertilized egg. The condition also seems to affect fertility in less direct ways, such as damage to the sperm or egg.
One of the treatments for infertility is intrauterine insemination (IUI). It is a procedure that treats infertility. IUI boosts the chances of pregnancy by placing specially prepared sperm directly in the uterus, the organ in which a baby develops. Another name for the procedure is artificial insemination. There are several reasons why people choose IUI. Firstly, it is less time-consuming, as it is a simpler procedure that typically doesn't require anesthesia or surgery, resulting in shorter procedure times. Next, IUI is less expensive because it requires fewer medications and monitoring appointments. And lastly, chance of getting twins is higher because it uses a lot of fertility drugs and increases the risk of multiple births. There are some procedures of IUI. Firstly, the woman may undergo ovarian stimulation with fertility medications to encourage the development of multiple eggs. The woman is monitored via ultrasounds and hormonal tests to determine the optimal time for insemination. After that, when ovulation is imminent, the male partner or donor provides a semen sample. The sperm is then washed and concentrated in the lab to remove seminal fluid and select the healthiest sperm. Next, a catheter is inserted through the woman's cervix into the uterus to insert the prepared sperm directly in the uterus. After that, pregnancy happens if sperm fertilize an egg, and the fertilized egg implants in the lining of the woman's uterus.
As a conclusion, infertility cases in Malaysia have seen a steady increase in recent years, affecting both men and women. Lifestyle choices, environmental factors, delayed childbearing, and underlying medical conditions are driving this trend. A significant portion of the Malaysian population is facing challenges in conceiving children. But don't worry, with proper access and utilization of assisted reproductive technologies like intrauterine insemination (IUI) and other ART treatment, the chances of successful conception have improved significantly. So, what are the ways to increase fertility for men and women? Let's talk for a man first. First, moving computers away. Prolonged use of laptops on labs can increase scrotal temperature, which negatively impacts sperm production and quality. Plus, computers emit electromagnetic radiation (EMR), which has been suggested in some studies to adversely affect sperm count and motility. Second, eat more food with folate. Folate supports overall cellular health and function, which is crucial for the production of healthy sperm and the maintenance of male reproductive health. Including folate-rich foods such as leafy greens, citrus fruits, beans, nuts, and whole grains in the diet can help men improve their fertility. Third, wearing loose and comfortable clothes. Tight clothing, especially underwear, can increase the temperature around the testicle. Higher temperature can negatively affect sperm production and quality. Loose clothing helps maintain an optimal temperature for sperm production. Next, let's talk for a woman. First, cut down of caffeine. High caffeine consumption can interfere with hormonal balance, which is crucial for regular ovulation and menstrual cycles. Reducing caffeine helps maintain stable hormone levels, enhancing fertility. Second, avoid vaping. As we can see today, vaping is not only popular among men, but women are also starting to vape. Recent studies show that vaping is particularly prevalent among the younger population, including teenagers and young adults. This is not good for their health, especially for their fertility. This is because the chemical in vaping products can affect the lining of the uterus, making it less receptive to implantation. Avoid vaping helps create a healthier uterine environment for embryo implantation and pregnancy maintenance. Third, get enough sleep. Adequate sleep helps maintain a balance of reproductive hormones such as estrogen, progesterone, and luteinizing hormone (LH), which are essential for ovulation and maintaining a regular menstrual cycle. In Islam, several important organizations and religious authorities have issued rulings called fatwas regarding the use of assisted reproductive technologies (ART) like IUI. These fatwas generally approve of ART as long as certain rules are followed. ART are generally considered acceptable in Islam. There are specific guidelines and conditions that must be respected. First, immediate implantation of the fertilized egg. After fertilization through ART, the fertilized egg should be implanted into the woman's uterus without delay. This ensures that the natural process of conception is respected. Second, use of husband's sperm. Only the husband's sperm should be used for fertilization. This upholds the importance of lineage and ensures that the child is biologically related to the husband. Third, involvement of medical professionals with strong faith in Allah. It's important for medical professionals involved in the ART procedure to have a strong faith in Allah. This ensures that the procedure is carried out with respect for Islamic principles and values. Fourth, privacy and modesty of female patient. The privacy and modesty of the female patient undergoing ART treatment should be carefully maintained. This includes ensuring that the procedure is conducted in a respectful and dignified manner, taking into account cultural and religious sensitivities. Bismillahirrahmanirrahim. وَأَنْ لَيْسَ لِلْإِنسَانِ إِلَّا مَا سَعَى, and that there is not for man except that good for which he strives. The verse from Surah An-Najm, verse 39, teaches us that we can only achieve what we work hard for. This relates to the effort to have a baby through assisted reproductive technologies (ART). It reminds us to keep striving for our goals, like having a child through ART, while maintaining faith in Allah's will. During the completion of this assignment, we refer to multiple websites to gather accurate and comprehensive information. These sources provided valuable insights and data that were critical to our analysis and conclusion.
That's all about infertility in Malaysia. We hope that through our presentations, all of us can understand and will learn more about current issues that happen to our country related to infertility. And with that, thank you.